Hello, my name is Hazel Campos, and my contestant number is 4577. I'll be talking about the body systems, relationships, and some diseases that are associated with them. Our body is incredibly complex, and it's organized into 11 systems that work together seamlessly, each contributing uniquely to overall health. The first one I'll be talking about is integumentary system, which contains the skin, hair, and nails, which serves as the body's first line of defense, and it also helps regulate temperature. It also prevents infections that could compromise overall health. Beneath this, we have the skeletal system, which provides structural support and protection to vital organs, working hand in hand with the muscular system to enable movement and support posture. The arrangement of bodily functions is directed by the nervous system, where the brain, spinal cord, and nerves coordinate responses to stimuli, ensuring swift and accurate responses. At the same time, the endocrine system communicates through hormones, regulating metabolism, growth, and maintaining homeostasis. This coordinates with the cardiovascular system to transport these chemical messengers throughout the body. As the heart moves blood through a network of vessels, it delivers oxygen, nutrients, and hormones to every corner of the body, synchronizing with the lymphatic system to filter and drain excess fluids while supporting the immune response. Simultaneously, the respiratory system ensures a constant supply of oxygen to the blood, while the digestive system breaks down and absorbs nutrients, fueling the body. The urinary system helps maintain balance by eliminating waste and regulating electrolytes. Reproductive functions governed by the reproductive system contribute to the continuation of life. First basic disease I'll be discussing is psoriasis, which affects the integumentary system, causing an overactive immune response that speeds up the skin cell turnover process. Symptoms include red patches with silvery scales, inflammation, and discomfort. Psoriasis is a chronic skin condition that can be itchy or painful. Treatment varies and it may include topical creams, phototherapy, or systemic medications. While there's no cure, management aims to control symptoms and improve quality of life. Prognosis varies from person to person. Some may experience periods of remission, while others may have persistent symptoms. Moving on to the skeletal system, we have osteoporosis. Osteoporosis involves a reduction in bone density and quality, making bones more fragile and susceptible to fractures. Symptoms may not be apparent until you get a fracture. Common sites for fractures include spine, hips, and wrists. Weakened vertebrae in a spine can lead to compression fractures, while the hip and wrist joints are prone to fractures due to structural stresses. Treatment focuses on slowing bone loss, preventing fractures like these. Medications can be taken like calcium and vitamin D supplements. Also, lifestyle changes like regular exercising and early detection can improve outcomes, but fractures can still pose challenges. Next, we have a disease that affects the nervous system called Alzheimer's. Alzheimer's leads to cognitive decline, confusion, difficulty with daily tasks, and memory loss. Alzheimer's primarily affects the cerebral cortex, hippocampus, and other regions of brain associated with memory and cognitive functions. It involves the formation of abnormal protein clumps and the loss of connections between nerve cells. In January of 2022, Alzheimer's prevalence in the United States is estimated to be around 5.8 million people. It's important to have a regular schedule of mental stimulation and exercise to prevent Alzheimer's. In the endocrine system, there is a disease called diabetes mellitus, specifically affecting the pancreas. Diabetes is a chronic metabolic disorder characterized by elevated blood sugar levels. It occurs when the pancreas doesn't produce enough insulin, which is known as type 1 diabetes, or when the body can't effectively use the insulin it produces, known as type 2 diabetes. Insulin is essential for regulating blood sugar. Common symptoms include increased thirst, frequent urination, unexplained weight loss, fatigue, and blurred vision. Diabetes affects primarily the endocrine system, but it complicates other body systems like the cardiovascular system, nervous, and renal systems. The cardiovascular system is affected by damage to the blood vessels, increasing the risk of nerve damage, leading to numbness and pain, and also strains to the kidneys, potentially causing kidney damage and failure. Coronary artery disease, or CAD, is a serious condition where the blood vessels supplying the heart muscles became narrowed or blocked, thus affecting the cardiovascular system. This occurs when the buildup of cholesterol and other substances forming plaques that restrict blood flows. Symptoms include chest pain and shortness of breath. Treatments involve medication and in some cases medical procedures like an angioplasty or coronary artery bypass surgery to improve blood flow to the heart. Next, we have a cancer that affects the lymphatic system called lymphoma. It typically involves the abnormal growth of lymphocytes, a type of white blood cell. Symptoms may include swollen lymph nodes, fatigue, and unexplained weight loss. The danger lies in the potential spread of cancerous cells throughout the body, impacting the immune system's function. Treatment varies and may include chemotherapy, radiation, immunotherapy, or stem cell transplantation. The respiratory system is affected by chronic obstructive pulmonary disease, including the lungs and airways. It is shown by chronic inflammation and obstruction of airflow, often caused by long-term exposure to irritants like cigarette smoke. People with COPD may experience shortness of breath, chronic cough, and wheezing. People affected can be treated with bronchodilators and inhaled corticosteroids. Next, we have Crohn's disease, which affects the digestive system. This causes inflammation in the gastrointestinal tract. The exact cause is unknown and is believed to involve a combination of genetics, environment, and immune system factors. Abdominal pain, diarrhea, weight loss, and fatigue are symptoms of Crohn's disease. Inflammation in Crohn's disease can occur anywhere in the digestive tract and may lead to complications like strictures or fistulas. You can take medication to reduce the inflammation, manage symptoms, and in some cases, surgeries to address complications. Next one I'm going to talk about is kidney stones. Kidney stones are formed when substances like calcium, oxalate, and phosphorus accumulate in the urine, creating crystals that can develop into stones. Factors like dehydration, diet, and genetics can contribute to their formation. Kidney stones primarily affect the urinary system. When stones form and obstruct the urinary tract, causing complications like infection or kidney damage, symptoms include severe pain, often in the back or side, along with nausea and blood in the urine. Increasing your fluid intake and medications can assist the stone passage. In some cases, medical procedures may be necessary. Lastly, I have the polycystic ovary syndrome that affects the reproductive system in women. It involves an imbalance of reproductive hormones, leading to the development of small fluid-filled cysts on the ovaries. You may have irregular periods, fertility issues, acne, and excessive hair growth. Factors like genetics and insulin resistance may contribute to PCOS. Managing symptoms, hormonal contraceptives, and medication to regulate menstrual cycles can help treat PCOS. Thank you for your time, and that was my human body system video.